let's start with this. So we've been talking about the ecosystem, just amazing all of the work that you're doing in the various sectors. And we already can see, and I've heard so much overlap. I'd like to hear from each of you, how do you see your work as it's within the context of the broader ecosystem? How do you think about your place in that ecosystem? And why don't we start with Ali?
So for us, it's kind of very clear cut where the empowering part of the ecosystem as it pertains to the science side with regards to the data-driven machine learning side of empowering personalized nutrition, but also other aspects of the ecosystem. So for us, we are really more the information providers, the science providers, the application providers in that sense. We're not doing the actual nutrition, but empowering others that want to do that.
Ambra?
I would say our focus is around investing in the human potential of the food system by taking an intersectional lens. Our goal is to unlock the inner food hero in women and girls, to educate, advocate, and innovate for the change they wish to see in their communities to be healthy, sustainable, and resilient.
Dr. Stacy?
Our primary goal is to motivate, educate, and teach in the truth. I actually call it truth in nutrition, clinical application, and food science, and to work to truly teach people from the true basics, from cleaning out their pantry to their shopping, to their cooking, to their preparation, to their analysis of the macronutrients and micronutrients. I am very dedicated, and our organization is extremely dedicated to broad spectrum giving of that message through large media approaches.
Thanks. Man, that's a great question. I think our role in that ecosystem is leveling the playing field. You know, building that basic foundation. We've got a 2030 bold aspirational goal to cut food insecurity to 5%. In the country, and to decrease disparities by 50% in communities of color and rural areas. And for me, that means you got to do things differently. So really coming in to get everybody up to the playing field.
Thank you. Sophia?
Brightseed's role in the ecosystem is, I think it was a yellow puzzle piece in ANA's puzzle of the ecosystem. We're at the core researchers and scientists that illuminate this dark matter of the plant kingdom and enable the use of bioactives for proactive health.
Megan?
Yeah, and I think that our research is really about trying to empower a critical stakeholder, specifically investors and financial markets, to drive a healthier and more equitable food system. And we believe that is through data and evidence-based metrics. And so if we can develop those metrics to help to quantify the impact that businesses have on our human health and health equity, I think that we can really actually move the needle in terms of where capital goes in the food system.
Fantastic. Nick?
And I think for us in San Diego, the whole food approach is a perfect alignment for our whole person wellness and the work that we're doing and really actively bringing in nutrition and food as part of that healing in addition to mental health and primary care.
Great. Well, let's come back to Ali here. So the next question we have is, what are you seeing as some of the greatest challenges to your work and the work in nutrition generally, and how do you see that connectivity through the ecosystem can help ease or overcome some of those challenges?
So from our perspective, we're a little bit concerned about the science regarding nutrition and the claims that are being made. For example, the supplementation space is ripe with a lot of different claims. The science to support it is a little bit requires more work. The human body is a very complex thing. So when we think about a single nutrient, a single bioactive, you cannot take out one part of the science. There are always correlations, but when you actually want to look at how a nutrient is processed in the body, there's so many different factors, we need to have the data for that. We don't have enough data to do that. So that's a significant challenge, and the only way that can be solved is through data sharing from our perspective. Again, we're very much into the ecosystem, data sharing, data sharing, data sharing. It's going to be basically the only way to go forward.
I think for me, if we were to see our mind as a metaphor in terms of a garden. The challenge that I see is the need for us to shift our mindset of one where we're planting hope and not dope. And what I mean by that is hope is having optimism, perseverance, and enthusiasm on life, whereas dope is doubting other people every day. And I think that's the inner battle that we are facing in building the public will, and why the conversation for me was about exercising our right in this democratic society of, are we wishing to plant hope every day in people's lives? Are we needing to pull the weeds of dope? So plant seeds of hope today.
Beautiful. Dr. Stacy?
I think our challenge is honestly fighting the social media wave and sensationalism of media, because we've taken a largely media approach to get our message, all of your message out. It's beautiful for all of us to come together as research and scientists and public health advocates and all of those sorts of wonderful things, but we've got to amplify to every living, breathing human being. And guess what? When you're trying to get your message out as a clinical nutritionist, you're competing with a lot of hype news and a lot of sensationalism and a lot of multi-channel, multimedia competition, a lot of lies. You're dealing a lot of times with unqualified human beings that are sharing with our public and our patients, our human beings that we want to help, are getting flat out wrong information from those who really aren't qualified to speak to clinical nutrition or nutritious food or nutritious choices. They're being fed many, many times media sensationalism, and it's because it's just fun and interesting. It's like reality TV. So that's my challenge, is trying to show our message as clinical nutritionists to the media when we're pitching and trying to get a story in about something like EPA, DHA, or just fish oil, or eating more leafy greens, or just very simple things, or seasonal eating. Or I want to talk about, to a broader media, to a national media, I want to talk about farmers markets, or how to source foods in a seasonal approach or in a more nutritional approach. Whatever it is we're working on, we have to come up with really weird and interesting tidbits to get them to bite. And we have to work really hard to get them to bite at something really super fascinating that they think the average person will want to watch for a few minutes. Because if we all don't catch someone's attention, and the media knows this, in 10 seconds, the first sentence that comes out of our mouth when we're presenting to the public in whatever forum is really what they hear, and they choose to click on the social media, to turn us off, whatever station it is. They choose within 10 to 15 seconds to turn away their attention. And that is really hard, because we love sharing lots of fabulous information with everybody, right? So that's my challenge. And because my life aspiration is to get it out to a larger media approach.
I think it's such a great point, and as you know from our discussions as leadership of the ANA, it's an organizational problem, right? We, have this amazing legacy and just body of science and credibility, and yet we do not have a huge megaphone to get it out there, right? That's typically what you find. We don't have a TikTok channel yet, but maybe we will, right? And one of the things that we're really looking at is working with the ecosystem to be able to amplify what we do, and at the same time amplify what amazing players in the ecosystem are doing. So that is a big piece of why we're so excited to have this panel here today, is to really talk about ways to do that. And we're obviously very excited to be an official partner of LiveWell San Diego, and really looking forward to partnership opportunities with everyone here on the stage in your organizations. So, Tom?
Yeah, when I think about the challenges, it really is that adoption piece. And if we're looking at the healthcare sector in particular, 12 years is just too long, too late, too little. Back in the day when I was actively researching in a hospital, we did a screen and intervene study in 4 hospitals with new admissions, where we tracked a couple of thousand patients coming in, screened them for malnutrition, and then intervened with nutritional supplements and education. And the reason I mention that is because at the end of the day, all those people got better. My mom was actually one of those, by the way, in her cancer, lung cancer surgery. But the bottom line that got the hospital to adopt that screen and intervene intervention was reduced length of stay, reduced readmissions. It hit the bottom line. In 6 months, we saved $8 million. So that was something that they could adopt, and they hardwired that into the EMRs, which is no small thing. We've got a Food is Medicine project launching next year in January with 30 of our food banks and their healthcare partners, where we're tracking individual outcomes of patients in a Food is Medicine model, as well as these health outcomes, kind of systemic outcomes. So excited about that. So I think that's the challenge, is to figure out how to accelerate adoption.
Sophia?
I was really impressed by your talk, and I think I would answer the question of what is the biggest challenge that Brightseed sees in two ways. Because first is accessibility, right? Like we cannot impact the trajectory of health if there are food deserts tomorrow in swamps, as you referenced, if the best solution, the worst plate out there is an empty plate. So that's number one. And Brightseed, we work with, say, the Bill Gates and the Bill and Melinda Gates Foundation to address that issue. And it's just fundamental. The second big challenge for Brightseed in this space is Dr. Ali, something you mentioned just now, is this is a complicated field. And the pharma paradigm of like one molecule hitting one receptor as hard as we can has all kinds of cascading negative effects and side effects. And to look at it in a systemic way, in a systems biology perspective from a scientific point of view, and then track that to health conditions or disease prevention opportunities that can really move the needle on that trajectory of preventable chronic disease. I think from a science perspective, it's very complex, and that's a big challenge. And we look forward to really putting our arms around all of that with humility on the acknowledgement of the complexity of human biology.
Hopefully. Megan?
Yeah, so I think I would echo what many of the panelists have said. I think that there are many challenges in our current food system, but I think most fundamental is that our current food system is not necessarily designed to improve our health and well-being. It is, in fact, disease-promoting in many respects. And so I think that understanding that challenge is very significant. And I think that the second major challenge is that we don't have enough data. And that was something that some of my fellow panelists have brought up. We need better data about the impact that businesses are having on our own human health. And part of that is having the types of metrics to be able to objectively and validly quantify that impact. And so I think that these are challenges, but as I mentioned in my talk, also opportunities. Opportunities for us to be able to engage with key stakeholders in our ecosystem, specifically financial markets, investors. If we can empower them with metrics and data to be able to take more evidence-based decisions, I think that will be able to really move the needle in terms of kind of addressing health issues, health inequities in our food system.
Well, that's hard to follow, right?
Yep.
All the above. I would put a strong voice towards poverty and food insecurity from my lens, and data, obviously. But I'll just add another, and I think that is, and take this with stride. If all you stay is in your own ecosystem, you will continue to get the results that you get. And that is, we have multiple ecosystems. So, and you have a big lift within your own nutrition ecosystem, I get it. But you have to span across the other ecosystems, or else you'll be siloed.
Yeah. What are some of those ecosystems when you think about that?
Well, emerging right now, which is pretty exciting, and I know you're going to fall off your chair when I tell you, but Centers for Medicare and Medicaid. Who would have ever thought CMS, with the Medicaid waivers, would give 2 states nutrition education funding to allow that? hallelujah, right? I mean, God, we were waiting for this for a long time. That's a whole nother ecosystem of Medicaid and, managed care, if you will. That's one. Obviously, the ecosystem that I talked about, in Live Well San Diego broadly, safety and others, because nutrition ties all ecosystems together. So, but I would just bring that one that's pretty emerging, that has not, I've seen, tapped at all by this ecosystem yet.
Amazing. Thank you. And I just want to note that it is 11:45, so anyone who needs to depart, please do. Okay, so let's give a warm applause to Nick Mascione. Thank you. He's got important work for the county to go and do. So again, thank you, Nick. And thank you, Tom Sommerfeld. Important work to do at Feeding America. So what are some of the things that are sparking hope for you all? What are the innovations you see? What are the things that are making you excited and think that, hey, yes, we have these challenges, but there's some really maybe important vectors that we can sort of pursue to move the needle? And anyone who wishes to take it.
So from my perspective, there are two things that I see as being very hopeful. One is the All of Us project by the NIH on gathering data for nutrition health and kind of connecting the two. What makes it very special is the diversity and inclusion of the data, because, for example, the UK Biobank data, which exists, it's entirely white, like 96% white population. And now with the All of Us project, we actually have a representative data set that represents this country. So that's amazing. I see that as a huge, huge boost to personalized nutrition, to nutrition access, to many, many different aspects of social determinants of health and how that impacts nutrition and class differences and everything else. On the social side, I see the potential of coming to an agreement from across different aisles, hopefully, on the concept of universal basic income. The concept of universal basic income, interesting enough, is something that many people from more of the progressive or liberal side and from the conservative side seem to agree on can provide some sort of basic cushion that allows people not to have to choose between electricity and food. And once we are basically at a level where people's food security is established, now we can focus on a lot more on the quality side and on the impact of the nutrition side. So I'm very hopeful for the universal basic income discourse coming to kind of to the surface. You see people like Jeff Bezos, people like Elon Musk discussing it, and these are not people known to be like significantly progressive in any way.
Yeah. Anyone?
I would say for me, to your point about NIH and other agencies, there has been a huge boost when it comes to federal food and nutrition programs in terms of their budgets, historically being increased because the pandemic showed the value of what it means to invest in food and nutrition. And it's one of those moments, sometimes it does take pain to shift us to purpose and get on the proper path that we're on. But in this national strategy, which takes a whole society approach of recognizing that it's not just industry, but it's philanthropic organizations as well as government and community, that we have two opportunities. One, the workforce, the need to diversify, looking at student loan repayment programs, not only through HRSA, which does need to create the scholarship that includes RDNs, but also NIH for those who are pursuing nutrition research to be able to have your student loans repaid as well. That's a huge opportunity for those who are looking to go into the field, not have debt, but also know that they can still make impact. And the other is the food as medicine. That space is only going to explode between venture capital as well as government investments happening. We've already seen the $8 billion commitment made by many organizations that Biden had announced on September 28th. But to see within that space, I raised a question, since equitable nutrition research is also on the agenda about whose food is medicine. So looking to the need to invest in traditional and indigenous foodways, African foodways. I recommend looking at my TEDx talk that just came out recently that I highlight some of the research out of UPitz that looked at swapping diets between African and African Americans and why we're not making more investments into looking at diversified diets. So those are the two key pieces that I would think about.
Beautiful. Thank you, Tambra. Began?
Yeah, I would definitely echo what Tambra just talked about in terms of food as medicine. I think it's a really exciting field, and there's a lot of political momentum currently in terms of thinking about how we can leverage food as medicine, whether that's through medically tailored meals, produce prescription programs, and both through kind of federal policies as well as the private sector. I think on the private sector angle, I think that there's a lot of opportunity here to think about what types of business models are going to be most financially successful and also drive health impact. I think when we talk about produce prescription programs, I think one of, at least my biggest kind of gripes with it is that it's about produce only. I think that produce is a critical part of a healthy dietary pattern, but there are other aspects of what make a diet healthy. And so that's where I think tools like Food Compass and different nutrient profiling systems really come in and are an innovative way to quantify the healthfulness of foods. And I think that allows us to be able to really think more holistically about what defines a healthy food or a healthy diet. And so our work on Food Compass is, and then what I talked about was a lot about, how do we engage with investors and think about how we can quantify the impacts that businesses have on human health. But tools like Food Compass can also be used for informing federal policies around kind of healthy food prescription programs, or around creating healthy incentives within SNAP, or informing kind of food procurement policies, or informing consumer behavior change. So I think that there's a lot of potential in tools like Food Compass to really be able to empower various different stakeholders in our food system to better understand the impacts that diet is having on human health.
I'll love to. Is this on? Yeah. Thank you. I want to piggyback on that because I love the call out of phytochemicals on the Food Compass, and it's one of the very first holistic nutrition metrics that include phytochemicals, otherwise known as bioactives, phytonutrients, polyphenols, and so it's really exciting that is a top of mind in the Food Compass metrics. And what excites me and what makes me feel hopeful is two things. One, the potential in that dimension of phytochemicals. At Brightseed, we have this privileged position to have the very front row seat in a really exciting theater of unveiling bioactive compounds. And we have predicted 25,000 potential bioactives that are just waiting to get validated and incorporated or optimized in the presence in the whole foods that they're already in. So that to me is fascinating and super exciting because it can just really transform how we do health through food, through whole foods and through the ingredients and their phytochemicals. The second thing that I find really exciting is that as we're launching our first bioactive ingredient, consumers love it. They love it and they get it and they react to it. And it's a very noisy field and it's a huge challenge. But I feel hopeful that the message is landing that whole foods have what make us healthy, that we now have the tools to see that. And if we can pinpoint it and communicate it effectively, it can go a long way. And I find that a hopeful message too.
Yeah, fantastic. Dr. Stacy?
I think I'm just most excited that the entire world is in the conversation regarding how we nourish our bodies. I also find it slightly apropos because we've been doing it for thousands of years.
Yeah.
And I think we complicate it.
Right.
But as you were speaking, I had this vision. I just returned from Africa. And in those communities, they very simply have a plethora of the exact diets that we discuss. They can go to a market any day in Morocco and buy 25 different varieties of olives. They can buy fresh meals, it's not really meals, but fresh ingredients to consume immediately. So I also think we underestimate the internal and natural wisdom of the entire global community, including the United States, and sometimes we complicate it just a little bit. But by the same token, I adore that everyone is discussing it because I can say, I used to be the weirdo doctor. Right? When you didn't know how to explain what you did for a living, you didn't know how to explain that you teach people diet and nutrition and et cetera, and it was like, what? Oh, what's your specialty? Clinical nutrition. What? Oh, what do you do? So like diet in like a hospital with diabetics? No. You know, and now when you tell someone that you meet new that you're a clinical nutritionist or you're in any sort of food field or functional medicine or integrative medicine or any of that world, they want to know more.
Yeah.
Like instantly.
Yes.
Tell me more. Oh, I just learned this, or is this true, or is that true, or I just read that book. Like that's my excitement because people can find books and they can find things online and they can see things on media and they might have to filter through some of the truths, but it sparks the conversation. And that piece is really, really interesting to me because not even 5 years ago, a lot of what we are discussing right now we just would have been, okay, they'll move on to the next person. They're not going to talk to you. So that's my excitement that we're actually debating about it and discussing everything that we need to be discussing in the broader community. And it's not just amongst all of us from an intellectual perspective.
Well, I love that. And I think that resonates, no doubt, with so many people in the room, right? So we've been doing this for years, and we haven't necessarily changed. We've been getting better, of course, but the world is changing and, right, starting to come to where we've been all along. So how exciting is that? Well, before we thank our panelists, just want to give a few announcements around very important food for lunch. It's what we do. So we'll have an hour now for our lunch break. And lunch will be served on the Palm Sail Terrace, located on the 6th floor of the Omni. And the ANA staff and volunteers will help direct you. And we'll reconvene back here at 1 p.m. Pacific, sharp, for the afternoon session on personalized nutrition and practice. And with that, please join me in thanking these amazing panelists for all this incredible information this morning.